Okay, so I'm going to show you the most important stretch from my perspective after your knee replacement is done. After knee surgery, there's a tendency to get stiff in the back of the knee, preventing full extension. To walk with low energy, you need to be able to extend your knee. And it should go all the way straight and not beyond. And so one of the mistakes I see people do after surgery is they leave something underneath their knee, which, as you can see, leaves it bent. That is not a good way to get a good result after knee replacement, although it is a fairly comfortable position to be in. It minimizes the pressure inside the knee, but it's not a good way to rehabilitate it. So sure, if you need a little rest and you want to sit and relax for a few minutes like this, that's fine, but the majority of your time should be spent with this support down by your ankle. And it's important to leave basically nothing underneath your knee, and that way gravity, as you relax, will tend to pull that knee all the way straight. And so this is how I recommend people stretch, primarily to regain full extension after knee replacement. And it should be ideally kept in this position for long durations, 10 minutes, 15 minutes or longer. It's really not possible to overstretch as long as it's not being forced in the wrong direction. I do not want you to do that. Once you get to full extension, meaning it's flat all the way along the front, you don't need to go beyond that for a good result. And so this is how to do it. Now, some people will have a tendency to externally rotate their leg. And when they do that, they're actually bending their knee to the side. And that's not a good way to go either. So what I would do if you find yourself doing that, create another bolster, use another stack of towels, and place it up against your foot so that it does not have a tendency to rotate out to the side. And that way gravity is pulling it straight, not bending it sideways. And a good way to know you're doing it correctly is that your kneecap should be pointing straight up and your toes should be pointing toward the ceiling. I would spend 10 or 15 minutes several times a day in this position, and I would do that every day with no days off until it's effortless after your knee replacement. And that might be 6-8 weeks or more. But this is a very, very important stretch, and it should not be neglected. Now I'm going to show you an alternative way to work on full knee extension after your knee replacement. This is called the prone hang technique. So to do this properly, you'd lie on your stomach, and you're going to leave your knees hanging off the end of the bed. And so I'm going to demonstrate how to do that here. So for this example, my left knee, which is moving up and down, would be the knee we're trying to get to go straight. And so early on, after your knee replacement, it might not want to go all the way straight. We're going to have gravity help us. This is a fairly powerful stretch, and the nice thing is that it does not require any effort once you're in position. Now to do it correctly, my kneecap is right at the end of my finger here, which is off the end of the bed. Now gravity over time is going to tend to pull this knee into full extension, just like that. If you would like to help it, take your other leg and put it on top and allow that to provide a little extra pressure. It's also possible to put a blanket or something on the back of your ankle, or have somebody do that for you to provide just a little extra pressure to allow it to go straight. As always, I recommend long duration stretches. 15, 20 minutes or more is not unacceptable. This should be limited only by what your body will tolerate in terms of discomfort. I would do this every day with no days off in an attempt to get as much full extension back as possible. This is a very effective stretch, and we use this ideally for everybody, but particularly when somebody's having difficulty regaining knee extension. I think this is even more powerful than the other exercise I showed you. Next, let's focus on regaining flexion. So I showed you how to make your knee go straight. Flexion is how to make it bend. And once again, I think the best way to do this is a way that gravity will do most of the work for you. And so just allowing it to drop off the side of the bed, I'm supporting with my other leg, and gently allow it to relax as your knee bends, allowing your ankle to gradually point right down to the ground. Looking at it from the side, you can see the gravity alone has allowed this to bend to 90 degrees. Now it is possible to use your other leg and pull back a little bit And that requires a little bit more effort. You can't do that for long periods because it requires you to exert muscle strength. Whereas just gravity alone lets you get to 90 degrees pretty easily. Again, to get a good result, you got to go beyond 90 degrees. I think until you get to 90 degrees, this is probably a very effective and simple way to stretch for flexion. And I would do this for 15 or 20 minutes, several times a day, every day, following your knee replacement. Once you get to 90 degrees, we need to give you some exercises now to go beyond 90. Back using a towel, if you were to wrap this around your ankle and gradually pull your knee up toward your body, here we have about 90 degrees. But if you keep pulling, you can go all the way up, basically pulling your heel right up against your butt. And that is an outstanding result, but it requires me to exert a lot of force. And this is going to be hard to do for long periods of time that are needed to regain this range of motion. Okay, so I'm going to show you another way, which is a little bit more passive, and it's going to be using the wall and the bed as a way to help improve flexion. And so I'm going to show you here how to do that. You would take your stiff leg, which in this case, it'll be the one closest to the camera, and if this is up on the wall, then gradually you can slide down the wall, and as you can see, gravity is helping this to go significantly beyond 90 degrees. And so then, if you can achieve that position, and so then you're much closer to that 120 degree angle that I'm shooting for after knee replacement. If you want even more, you would need to bring your butt closer to the wall, and that will provide even greater flexion. Now, to start with, you can do that as well. If you're closer to the wall and you walk down the wall with your feet, you can see gravity alone is going to help this to bend even more. So again, this is a very good way to passively regain knee flexion.